Joint pain affects more than half of adults over 60. Stiff knees in the morning, aching hips after sitting, wrists that ache with simple tasks. These symptoms are common, but they are not inevitable. And what you eat has a direct, measurable effect on joint inflammation, cartilage health, and pain levels. Today, we're covering the foods that actively support joint health and reduce inflammation, and the foods that make joint pain worse. This is one of the most actionable videos we've made, because the dietary changes that help joints the most are the same ones that benefit heart health, weight, and energy. Your joints are surrounded by cartilage, a smooth, rubbery tissue that cushions bones and allows them to glide against each other. Cartilage doesn't have its own blood supply, so it gets its nutrients from synovial fluid, the fluid inside joint capsules. Osteoarthritis develops when cartilage wears down over time. It was long thought to be a purely mechanical, wear and tear disease, but research now shows that inflammation plays a central role in both the onset and progression of osteoarthritis. This is why diet and lifestyle, which directly affect inflammatory levels, genuinely impact joint health. Rheumatoid arthritis is an autoimmune condition where the immune system attacks joint tissue, and dietary factors have significant effects on disease activity and inflammatory markers in RA as well. Fatty fish, salmon, sardines, mackerel, trout are the most powerful dietary anti-inflammatory. Omega-3 fatty acids directly reduce the production of inflammatory compounds that damage joint tissue. Multiple clinical trials show that omega-3 supplementation or increased fatty fish consumption reduces joint pain, stiffness, and anti-inflammatory medication requirements in people with arthritis. Extra virgin olive oil contains olecanthal, a polyphenol that inhibits the same inflammatory pathway as ibuprofen. It also reduces inflammatory markers in the blood. Use it as your primary fat for cooking and dressing. Colorful berries, particularly blueberries, strawberries, cherries, and tart cherries, are rich in anthocyanins, powerful antioxidants that reduce oxidative stress and inflammation in joints. Tart cherry juice specifically has been studied for gout, a form of arthritis, and has been shown to reduce attacks significantly. Leafy greens, spinach, kale, broccoli, and Swiss chard are rich in vitamins C and K, calcium, and multiple anti-inflammatory compounds. Vitamin C is essential for collagen synthesis, the protein that forms the structural scaffold of cartilage. Cruciferous vegetables, broccoli and Brussels sprouts, contain sulforaphane, which has been shown in laboratory studies to slow cartilage damage and block enzymes that contribute to joint breakdown. Garlic and onions contain diallyl disulfide and quercetin, compounds with established anti-inflammatory and antioxidant effects. Regular consumption is associated with reduced osteoarthritis severity. Turmeric and ginger are two of the most studied natural anti-inflammatories. Multiple clinical trials show curcumin from turmeric reduces joint pain and stiffness scores in osteoarthritis, comparably to some over-the-counter medications. Ginger has similar but less pronounced effects. Walnuts and almonds provide omega-3 fatty acids, vitamin E, and polyphenols, all beneficial for joint inflammation. Bone broth contains collagen, gelatin, and amino acids like glycine and proline, the building blocks of cartilage. Some evidence suggests regular consumption supports joint health, though the research is less conclusive than for fish and vegetables. Certain foods consistently worsen joint inflammation and pain. These are the main ones to reduce. Refined sugar and refined carbohydrates directly trigger inflammatory cascades. Sugary drinks, pastries, white bread, and processed snacks worsen inflammatory markers and have been associated with increased osteoarthritis risk. Processed and ultra-processed food contain combinations of refined ingredients, artificial additives, and industrial fats that collectively promote systemic inflammation. Excess omega-6 fats from industrial seed oils, soybean, corn, sunflower, cottonseed, tip the omega-6 to omega-3 balance sharply toward inflammation. Replace these with olive oil and avocado oil. Red and processed meat, particularly when consumed in high quantities, elevate inflammatory markers. Processed meats like sausages and deli meats are particularly associated with inflammation. Alcohol worsens gout attacks significantly and contributes to systemic inflammation. Salt, high-sodium diets are associated with increased inflammatory markers and may worsen water retention around inflamed joints. Body weight has a profound and direct mechanical effect on joint health, particularly the knees and hips. For every pound of body weight, the knee joint experiences approximately 3 to 6 pounds of force with each step. Losing just 10 pounds reduces the force on each knee by 30 to 60 pounds per step, a dramatic reduction in wear and pain. Weight loss also reduces systemic inflammation, because fat tissue, particularly visceral fat, produces inflammatory compounds that worsen joint disease throughout the body. Multiple studies show that even modest weight loss, 5 to 10% of body weight, produces significant improvements in knee pain, function, and quality of life in people with osteoarthritis. A few supplements have reasonable evidence for joint support. Fish oil at 2 to 4 grams of EPA plus DHA daily has the strongest evidence for reducing joint pain and stiffness, particularly in rheumatoid arthritis. Glucosamine and chondroitin, the most widely used joint supplements. Evidence is mixed. Large trials show significant benefit in a subset of patients with moderate to severe knee pain. Less effective for mild arthritis. Worth trialing for 3 months to assess individual response. Collagen peptides, hydrolyzed collagen supplements, have shown modest benefits for joint pain in several clinical trials, likely by providing the amino acids needed for cartilage repair. 10 grams daily is the typical dose used in studies. Curcumin with piperine, well evidenced for pain reduction in osteoarthritis, comparable to moderate anti-inflammatory medications in some trials. Your joints respond to what you eat. An anti-inflammatory diet built around fatty fish, olive oil, colorful vegetables, berries, and turmeric can meaningfully reduce joint pain and slow cartilage degradation over time. And reducing refined sugar, processed food, and industrial seed oils removes the fuel that feeds joint inflammation. Combined with maintaining a healthy weight and staying physically active, which actually nourishes cartilage through movement, these dietary strategies give your joints the best possible environment for staying healthy and pain-free. As always, please discuss joint conditions and supplements with your doctor, particularly if you're on blood-thinning medications. See you in the next video.